Guide Us TV, watched by many, loved by all. New Muslims, young Muslims, born Muslims, non-Muslims, all enjoy it. Guide Us TV, never ads, always free. Let's keep it free, no ads. Support and share, and get guided with Guide Us TV.
A way of life, a way of life, a way of life, a way of life. Islam is a way of life, a complete way.
And we're coming to you almost live all the way from our studios right here in Southern California. Yeah. And to help us with our program tonight, we have Sister Kim is with us. Sister Kim, salam alaikum.
Wa alaikum assalam. How is everything in California?
Oh, wonderful, 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 wonderful. We're just keeping really busy here. MashaAllah. This whole setup that I've got here right now is kind of an interesting thing, but we're not going to really talk about it tonight. What we want to focus on to start the program and end the program, this is Doctor's Night, by the way, but to start the program and end the program, I have to continue what we started last night, because we found out that one of the children in the contest was not judged, and then we had to throw everything back and do that again. So I want to be sure that everybody knows that whoops, I don't know what happened. Anyway, so I want everybody to know that as soon as that child has the opportunity to be judged, most likely it won't be the first place, because I did hear the child, and I have an idea who they're going to choose for the first place of each of the categories, and that's been added. We're going to give a award for each single category. That's the ages 3 to 7, 8 to 12, 13 to 18, or 13 to 17, and we'll get in a couple days. So even if they turn 18 in that month, that was okay. So I wanted to be sure everybody knew that. And then plus the grand prize winner, who is not going to be one of the ones from the age groups, because that wouldn't be fair to the kids, So we will have 11 winners. No, 1, 2, 3. I can't count tonight. 1, 2, 3, 4 winners. 4 winners. Yeah. You have 11. Blah. I don't know what is with the number 11 tonight. I don't know what's going on. Anyway, now we're going to come back to the portion of our program about our doctors who are with us tonight. And here it is, right here. Assalamu alaikum, Dr. Ado.
Assalamu alaikum wa rahmatullahi wa barakatuh, Sheikh Yusuf. How are you?
Alhamdulillah Rabbil Alameen. We also have with us Dr. Sultan. Assalamu alaikum, Dr. Sultan.
Wa alaikum assalam rahmatullahi wa barakatuh.
I'm going to start with you.
Eid Mubarak.
Eid Mubarak, mashallah, Eid Mubarak. I'd like to start with you if you don't mind. I would just like to get some kind of an idea from you about what you're seeing there in your area with this variant. If you could talk about that, please.
Yes, thank you very much. Well, this variant, Missouri is the capital, and the main reason it's capital is that there are a lot of people who refuse to take vaccination, and that is the main reason of this Delta virus. Besides being a much more virulent strain, the second thing is people are not getting vaccinated. So combine these things together in the political environment, all that stuff, that we are in a really, really bad situation with this. Look, I'm amazed. You see, the county executive ordered that there should be masking, all this stuff, and the attorney general sued that why do they want to have masking again? They said we don't care why we will fight in the court, but we are implementing the mandatory masking indoors starting today. I mean, what amazes me is that the scientific mind of this such a country which is so much, number one in science everywhere. I don't know what has happened for political reasons. All the science has been forgotten, and they're just taking their whims and wishes to implement on and making it so much dangerous for everybody that it's just beyond my comprehension. I've never seen such a non-scientific thing in this scientific world, part of the world. I don't know.
MashaAllah. I had no idea about that. I think it's time for us to take a turn over to Dr. Adil in Tampa, Florida. Doctor, can you tell us what's going on? I got both of you on the screen, by the way. Go ahead.
Oh, Salam alaikum, and salam alaikum, Sister Kim. It's been a long time. It's been a long time. We haven't discussed the temperature and then your neck of the wood, but Eid Mubarak to you and your family.
Oh, Eid Mubarak to you and your family as well.
So basically in Florida, it's all red. Everybody's been watching the news. Every county have elevated numbers of new cases, hospitalizations on rise, and certainly people getting ICU and so on. And that is not good because we have a large portion of senior citizens live here in Florida, and that is not good news for them because of comorbidities and so on. And all over the United States, there has been increase and surge of cases. I don't know what is where's the basic common sense of 2/3 of the people have at least have gotten the first shot, quote unquote, vaccinated, and similarly the seniors in the state of Florida have gotten majority of them, 60% or so according to the stated numbers. Then the things should be under control. But why all this stuff is happening? Why all of a sudden now we're seeing a call for possible third vaccination shot for those immunocompromised? And by the way, when you look it up, 15 million in the United States are called now and titled and have this immunocompromised as a diagnosis in them, whatever the etiology may be or the cause may be. And then we add to it, a lot of seniors who have, not as even healthy seniors, their immune system is not as strong as younger ones. And we have, millions of people who have diabetes and cancer and immunosuppressive therapy and chemotherapy and all that. So all those people, are they going to get a third, shot of vaccine? What is going on? I believe that there should be no discussion about the masks. Absolutely not. And we know if we go back, and everybody goes back, we've been doing this for 17 months now. And everybody said just having a mask will half the mortality, will cut down the death rate by 50%. Just having a mask, and now I think people are going into mandatory masks. Not only that, and I'm glad Sheikh is putting this on. That's a good thing, and we better get used to it, because this stuff is not going away for a long time. And now people think, well, I'm vaccinated, I'm all set. We encourage everybody who's not having any reason not to go ahead and take advantage of that for their protection and protection of others. But then we have to look beyond the short-term, knee-jerk reflex of, okay, I got the vaccine, so what? Well, we're going to have to look back, go back to basics and look at the immune system. No matter how you cut it, going back to the immune system and how to make it strong, how to make it resilient, how to make it able to resist any invading organism, whether coronavirus, Delta, any bacteria, any other pathogen or fungus infection that could come along and be invading the body, because the body has no defense mechanism. And no matter how you look at it, because you obviously cannot chase every variant. Now the replication of the new variants are happening at an accelerated rate, and you cannot keep up with it. And then maybe now the Pfizer vaccine is not as effective in the Delta variant like it did with a 95% success rate in the original coronavirus, the 19 when we first started. So now, is it going to be catch-up phenomena? Are we going to be like short of breath soon, just looking at how we can basically catch up with all that? I believe going back to the food, going back to the water, going back to getting back at getting rid of bad habits that will depress the immune system, getting rid of an anxiety and depression, because it add up to the weakening of the immune system. And we have the total body wellness, physical, mental, spiritual wellness. That is the only long-term effective counter mechanism for coronavirus and any other invading virus, after stabilization with vaccine.
All right. That was a mouthful, right? Okay, but let me see. I can't see my monitor. Oh, okay, yeah. Dr. Sultan, I would like to get a bit of an update there from you. I know your wife is dealing with immune system and allergies, etc. Is that right?
But she deals with infectious disease. I deal with allergy.
Oh, okay. You're the one dealing with the allergies. Maybe
Right.
Maybe I should tell you about my allergy. See, never mind. But seriously, when people have allergies, and I am asking this for my own benefit, but I hope everybody else will get a benefit out of it too. But I do have an allergy to something called the rosebush. I don't know if you've ever heard about this before, but it's called the rose gardener's disease. Have you heard about that allergy?
Well, I mean, you can be allergic to any plant. It can be contact type of allergy, like you get rashes, or it can be a respiratory allergy, like runny nose, stuffy nose, coughing, wheezing, and stuff like that. So the allergies can be various kinds, depending on what we are talking about. So basically, the point in here is, I can't ask you medical question, so what you have given the information. If you give me more information, I can be more specific. You see.
Well, okay. If I get any open sore, or I get cut by the rose thorns or anything like that, then I'll show you. I don't know if you can see the video right away, but there are a huge number of pictures here on the internet on let me see if I can put that up. Yeah. Ooh. Now mine never got this far because I have doctors here that help me out, and they were very attentive to it right away. But this is an image of what the roses can do to a person. This is a dermatology advisor who put this one up. Here's another one. Let's see. Yeah, there you go. It really gets bad. Yeah, there's another one here. This is a kind of like what I had on my arm right there. This, I know it'll take a few minutes for you, well, a few seconds actually for you to be able to see it. But when this happened to me, I made the mistake of putting a salve over it, and it complicated it and made it even worse. And then the doctor told me, get the salve off of it, and just let it be open and let it heal up. And it did. And of course, he gave me medication for it too. So yeah, are you able to see it, what I was talking about, or did you?
No, I'm trying to get to your page.
Just all you got to do is type in guideus.app, guideus.app, and it'll show you. That's the best way. Everybody watching, by the way, I should do a plug for Guidus TV right now. Yeah, guideus.app. It'll upload it to your phone right away. But it's not the full app. The full app is on our server, so you don't have to pay for anything. It is absolutely free for you, and no ads, no spam, etc., etc. So yeah. Anyway. Did you try that, doctor? Did that help?
Yeah, I'm on that Guidus app. I'm right there.
All right. Now on the left side it says live. Click that. Then it'll give you two choices, two bars, so across the screen. Take the top one, and then you'll be watching.
I cannot get to that. I mean, I see it right in here, view, and it doesn't do anything here for right now. So let's talk some other subject, because
all right.
Just...
But when somebody has, let's just say a high immunity to a bunch of stuff, not immunity,
Allergies.
allergies. That's the opposite. Yeah, I guess. So if somebody has allergies, does that indicate that their immune system maybe is weak, or if there's a virus going around that they could get it easier? I don't know.
Okay, yeah. See, basically, our low immunity means that our immune system does not respond to our environment, including infectious agents. Okay, so that's the lower immunity. Okay. Number two is the allergies. When our immune system hyper reacts to something in our environment, like dust, mold, pollens, foods, etc. So that is the hyperreactive response. Whether the response is suppressed immune system or heightened response, both cases, it predisposes you to more infection. For example, let's say you have nasal allergies. So your nose is congested, running nose, stuffy nose. That becomes a source where bacteria, fungi, and viruses can easily proliferate. So therefore, one of the strategies of strengthening the immune system is control your allergies. When you control your allergies, that will build up your immune system to fight infections better. If immune system is suppressed, on the other hand, it will do the same thing. You won't have the allergies, but you will have more proneness to various infections, bacterial, viral, and what and what not. So that's the main thing. In either case, if untreated allergies or unrecognized, untreated immune system, poor immune system, both will predispose you to all infections, including COVID. So this is one of the most important strategies to control to build up your immune system is see if you have inhalant allergy like dust and mold, food allergies, chemical sensitivities, take care of all those things and provide proper nutritional base along with taking care of any hormonal problem that you may have. For example, low thyroid predisposes you to all kinds of infection. And similarly, low male hormones also predispose you to infection. So you have to build up the immune system by taking care of the environmental factors, nutritional factors, and hormonal factors, and that will ensure you that you cannot that you are more immune to external environment. This is something I have talked about before on this, but I will, because it's so important, so critical for to bring this subject up, is that we know who Louis Pasteur was. He was the one who coined the concept of infectious diseases, that the bugs cause disease. And his opponent, or not opponent, but his contemporary, Dr. Bernard, he said, no, that's not the thing. We're all surrounded with bugs and everything else, but we don't get sick because our immune system is capable of fighting all these bugs around. So it only happens when our immune system goes down. But Louis Pasteur never agreed with him until on his deathbed, he said, yeah, he was right. Microorganisms are nothing. It is the terrain, the environment, the terrain, the human body terrain that makes all the difference. So that is why in our programs, we talk about, yes, coronavirus is there. And what you do is, number one, minimize the exposure. That's the same principle allergy treatment. If you're allergic to dust, try to minimize exposure to dust. And similarly, so wearing masks, washing hands, social distancing will keep you away from the infectious agent. Now, this is so interesting. You brought up my wife with infectious diseases. She always reminds me for the last 17 months, the incidence of respiratory infection, flu, and parainfluenza and other rhinovirus, it practically went way down because people were masking and doing social distancing. But ever since the mask mandate was taken away, people getting more and more liberal. Same, all infectious diseases, respiratory diseases have come back. So the key in here is good nutrition, good diet, exercise, rest, and that will bring maximum improvement in our health and minimize the chances of getting a serious infection like COVID. Now, Dr. Adil was mentioning about wellness, and he gave some pointers of physical, mental, and spiritual wellness. And what does that mean? So I just wanted to touch on that subject because he brought that subject, and many people do not understand what wellness really means. It is physical, mental, and spiritual well-being. That is point number one. And it should be brought through diet, exercise, and lifestyle changes, including spirituality. Many times people confuse this wellness with the medicated state of wellness. Again, the medicated state of wellness. What I mean by that is somebody comes, my cholesterol is high. My doctor has given me a statin and my cholesterol is fine. oh God, I said, well, the guy comes and says, diabetes? Oh, I've on such and such medication. My sugar is just perfectly fine. Somebody comes, blood pressure? Oh, my blood pressure is fine. My doctor is giving me 2 blood pressure medication. It's just so. That is all false state of medicated wellness. That is not a wellness. Wellness is when you combine the diet, the environmental changes, and nutrition, exercise, and spirituality. That brings you the wellness. And this is one of the things that we talk about this program, how to bring that state of wellness, which involves no drugs at all. So that is the most important thing to realize.
So
I'm going to add to Dr. Sultan a couple of important things that people are not aware of. Stay away. I know there's a lot of abuse of steroids, for instance. Anything that people cough, anything that itches, anything that have emphysema or other arthritis, you just give them steroids, and knowing that it will cause to diabetes and will cause to impaired and significant weakening of the immune system that will lead to infections and so on. So that is one thing that everybody should be aware of. And then all the other medications that are promoted to help eczema and other things, but it will depress the immune system so bad that will lead to a whole host of secondary infection. Some of them are lethal because it suppresses the bone marrow and so on. So I hope that people now will think about twice before they take the steroids and make sure, is it indicated or not? Is it worth it or not? And then they have to balance the risk-benefit ratio with their physicians, because if it's going to do more harm than good, then stay off. And if it is needed, that it's only needed as a crutch, if you would, for a certain limited period of time, but not for a long period of time that will kill what's left of the immune system.
I think, Dr. Azad, you brought up a very important point in here, in that I will also add, and beside the steroids, add another trend in the medicine that is a very wrong trend, is using immune suppressive drugs for common conditions like autoimmune disease, like rheumatoid arthritis, like lupus and related conditions. For example, methotrexate, they're using like water, and that so massively suppress the immune system and super infections and everything else. All those immune suppressive drugs, we should, including the cancer therapy, but cancer is altogether different subject. Leave alone the ordinary people with autoimmune diseases. There are so much immune suppressive drugs are being used that psoriasis, you see similar, they will use immune suppressive drugs for simple skin condition like psoriasis. And that will, that will immediately give you relief. Yes, I understand. But what are the long-term serious consequences? I won't even give these immune suppressive drugs even to my enemy, you see, which are being used as a friendly prescription to various patients, So I just wanted to bring up that important point too.
MashaAllah. Well, all right. Dr. Adil, I would like to find out from you, what do you think is the future for long-term future for this? I heard you say earlier that this is not going to go away soon, but is this something that we need to learn how to live with forever, or what do you think?
From what, I'm going to be very honest, from what I've been reading and observing and discussions and so on, everybody said, be always ready on the next pandemic, 2024, this and that. But I'm not going to get into speculations. All what I'm going to get into the real fact that there may be, challenges coming with, either new versions of coronavirus or other viruses altogether or other infections that we have to be ready to combat and ready to fight and resist, because we know the only measure that's proven success. What happened to the regular flu, by the way? Nobody's talking about it. It used to kill, hundred thousands
Well, we
every
just,
year.
I think we just heard Dr. Sultan speak about the flu. Maybe they are seeing less cases of it right now because people are wearing the masks and social distance. So that would.
I'm talking about the mortality, like people, like Fort
Oh.
Gilgan, that was significant, and all of a sudden, it's hardly, spoken about. Similarly, one thing that I can tell you from heart disease during the COVID pandemic, a lot of people, quote unquote, lived with the pain. They didn't go to the hospital. They didn't have procedures that will be, getting right away with their stents or bypasses, because a lot of people were concerned about getting infected or not making it if they go to the hospital and then they had a complications, whatever. So a lot of people learned actually to have quote unquote, live with pain and maybe able to modify that with medications and lifestyle, and then get more into wellness rather than just here we're just going to put this device, because obviously you cannot put a full metal jacket. And I said that to so many people, way back in New York in the 80s and 90s, when people think that could be an ultimate cure and fix, because the whole body's full of tubes and you cannot put a full metal jacket if you would, and think that will stay open or that will be the end of it. So back to basics. The no matter how you cut it, for any disease prevention, for immune strengthening, for actually saving tons of money and preventing also complications, unnecessary, avoidable, preventable complications of procedures that could have been handled with conservative medical therapy, as so many trials are showing equal outcome. So now there is going to be definite transformation when people are thinking about which the best way to go. And I believe more and more people will be lenient to conservative approach rather than having a invasive and approach to things that could be managed with optimal therapy and lifestyle modification that we've been saying all along. It's not going to only work for COVID, but it's going to work for everything else. It's going to work for heart disease. It's going to work for cancer. He said half of the cancer of the world. This is straight from a recent, gastroenterology, World Gastroenterology Conference in Europe, related to alcohol consumption. So if we stop alcohol and tobacco, that's 75% or 80% of cancers right then and there, avoidable. And we have to let people know all the toxic effects and the negative effects, so people can learn. And then when they think about it, what's going to happen to them damage-wise, both health and financial, and from all the devastation that will come with infections and depressed immune system and so on, they will have to think about that twice, because now we're making them educated and empowered to help themselves, not only medically, but financially. And a lot of people now, they're starting mandates. We didn't mention that. And I know I saw an article about, some workers in the hospital in Jersey said, well, guys, if you're vaccinated or you're out. So they're, people gonna be, kind of forced into it in a way that, either they're gonna be vaccinated, especially the healthcare workers or hospital staff, or they're gonna lose their job. So there's choices, and I believe the kind way is to empower people, help them, and show them how to take care of themselves, to be healthy and to make others healthy, because now your health is my health, and Dr. Sultan health, and the neighbors and friends and nationwide and globally, all are interconnected. So let's spread wellness, health prevention, and spread new transformation of healthy lifestyle, and that will translate to billions and trillions of saved, wasted healthcare dollars and devastated people, just simply because they didn't take care of all the preventable things. That's very simple. cheap stuff, just tell them stay away from, and learn abstinence, because that's a critical factor that will be involved in so many disease prevention processes that we'll have to educate people about.
Okay, well, I do have another question. Maybe.
Before we go to another question, we should take a break.
Oh my
He's right.
goodness. Oh yeah.
Sister, you're ahead of the game.
Okay, here's how you guys can be our Dawa partners and join us and get the rewards of what all of the things that we're doing. And so just stay tuned. We'll be right back right after this. So stay tuned and stay guided with
Guidance TV.
This is Yusuf Estes, and I'm looking for something. Actually, I'm looking for someone. Is that someone you? I want Dawa partners, and you can be my Dawa partner right now. It's real easy. Just go to dawapartners.com, sign up, and join me. There are 3 things that I would like for you to be able to do. Any one of them or all of them. Beautiful. Number 1, you will make dua. So you can be our Dawa partner, even if you don't go to the website, but I hope you do. Number 2, share. Share this message and let other people know about becoming Dawa partners. And number 3, help us financially. Donate on a monthly basis, even if it's small. Allah loves the thing that you do regularly, even if it's small, more than the thing that you do that's really big, but you only do it once. Join me as a Dawa partner. Do it now. Click, 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 click. And we are back. MashaAllah, MashaAllah. My question, and I've been burning to ask this question to the doctors, both of them. I would like to get some information from the source. How much percentage of our money that we're putting out on Medicare or getting, dealing with paying our bills and so on, my wife and I both have to pay a certain percentage, even though we get Social Security. So we have to pay money, but how much of it is really wasted? How many things do I take a wad of pills every night? Yeah, a lot of it's just over-the-counter stuff, but I want to know, is that a problem? Maybe you could help us out with that.
Yes, it's a huge problem, and there is billions of dollars that are wasted every year, according to one report. We're number 1 spender in the world, but rated number 37 in healthcare when measured by healthcare parameters. We know that if every 18 cents of every dollar goes to healthcare expenditure. But there is a huge waste in the healthcare, estimated about $760 billion per year. So 760 billion, not million, $billion. So we're getting to be in a very high waste that is certainly not translated to better health. So how could we get that number down? It's not going to be down to 0, but how we can save billions of out of the 760 and a billion that is mentioned. Well, we can transfer a big chunk of the healthcare dollars into prevention, because we know if I prevent, for instance, early detection of cancer, for whatever cancer is, breast cancer, prostate cancer, lung cancer, by early detection and screening, you know what? That will get me, maybe we'll catch it early, and that will, prevent it from getting metastasized and spread everywhere. And then we have huge costs with chemotherapy and all that. And most of the cases, they don't do much, and that in the first place could be preventable. I just mentioned the 2 biggies, that the issues that we can really impact billions of dollars of healthcare spend is alcohol and tobacco. And now we can add vaping, and we can add other toxins to it as well. And of course the opioid. The opioid has cost billions of dollars again in waste healthcare costs and expenses. I mentioned the other day there's $1 billion of healthcare dollars spent only on trauma related to gun violence. So if we address that and switch that, maybe we can get people now to eat healthy food, get rid of what we call the health deserts. And I mentioned that 30 million or so American lives in those called health deserts, where there's no access to fresh fruits and vegetables, period. And it's places where people have a lot of places that have high amounts of alcohol and have a lot of carbohydrates and so on. So people eat the wrong food, and they become diabetic and hypertensive and have heart disease and cancer and so on, and alcohol on top of that, and then you go to the hospital, and then it goes into the vicious cycle. So, and we have to invest in the social determinant of health. It started happening, like if I'm a senior citizen and limited income, I don't have a car to come to see the doctor. Well, one of the choices now that are being addressed, either we come and bring a bus or Uber to pick you up to the doctor's appointment, or we can have telemedicine so that you could see your doctor from place of residence, and you don't have to to drive and worry about transportation. There are some innovative things, but part of it is use cheaper and effective equivalent medications. As long as it have the active ingredients and as long as it gets to the patient and the patient can afford it, because sometimes and this is happening so many times, a patient that prescribed a medication by the doctor, and you know what, we have to put the social status of the patient in consideration when anybody writes a prescription. I know that this person is not going to be able to get specific medication because they're on limited income. You know what? They're going to have the prescription but not going to fill it because simply they can't afford it. And guess what? They're going to have serious consequences, especially, and I've seen it with heart disease, where they have a fresh stent put in, and the stent can get blood clots and can lead to fatal heart attacks and so on, simply because they couldn't afford that. So we have, and there's other cheaper alternatives out there that will do the same job, and the people can afford. So, and they will still have put money on the table and pay bills and so on. So it's a very, very, very interconnected, but there are simple solutions that will, for sure, get out of the 760 billion that's wasted every year to turn into part of it, invest it into people's health, well-being, nutrition, advocacy, and also lifestyle modification. And if we can do this collectively, that will help us not just during COVID, but lifelong, and it will have a great return on investment in the people's health, and also preventing future costly procedure, hospitalization, and devastation, when number one cause for bankruptcy in the United States is unpaid medical bills.
That's number one. I didn't know that.
Oh yeah. I mean, people can't pay their bills, so they go to bankruptcy as number one. You can Google it and see it, because that's everybody's kind of concern. And now affordability is going to be on the center point of people's choices for medication, therapies, procedures, and anything. I will get what I can afford. If I can't afford it, most likely I'm not going to get it. That's just and so if we make that easily accessible and concentrate on patient education, empowerment, and just provide them with healthy food. It doesn't have to be expensive. It could be very cheap, low cost, but very high nutritious food in the value. And that could go all the way to really transform the incidence of disease, severity of disease, and all the complications that come along with it. And that's been proven by so many studies. It's like unbelievable, but we have to transfer all this data into actual, practice to help so many millions and millions and millions of people who are, for whatever socioeconomic factors and so on. They're getting deprived from access to affordable health care, and really it's the solutions is simple. And don't order anything fancy or anything that fancy tests or fancy medications. As long as you know that there is a affordable alternative that will do just the same job, that will do as much benefit, and will be just as effective. So it's going to be about choices, and the more people learn about the socioeconomic factors that will affect the medical quality and the healthcare of folks, the more that they are in tune to follow those instructions, because they want to eat, they want to have food on the table, they want to have their kids go to school and so on, like everybody else, want to pay bills and continue to navigate through life.
Okay, well,
Yeah.
I think Dr. Sultan is back with us, and I'd kind of like to ask him, because he always has a good presentation about healthy eating to prevent just exactly what you were talking about, to prevent our system from failing to recognize or deal with some of the things that have been happening. So if you don't mind, Dr. Sultan, we'd like to ask you to talk about that for a little bit.
Yes, I would love to do that, but I just want to make an addition to what Dr. Adil was saying. You see, if we have to have an affordable medical care, whether right now my audience believes or does not believe, the truth of the matter is that it has to be based upon treatment plan that is void of drugs. Drugs only cover up symptoms, is the most expensive way of treating the problem, and it is the most expensive way to ruin your health. Every drug, because 250,000 people each year die from proper use of medication, whether it's blood pressure medication, sinus medication, arthritis medication, immune suppressive, cancer, and on and on. And the key word is proper use of medications. So it raises a question that is there a way to treat chronic ailments without the drugs? That's number one, which is effective. And number two, is it superior to our current drug system? The answer is absolutely yes to both those questions. So as I said a little while ago, that what is wellness? We achieve wellness through our dietary factors, lifestyle, and exercise. So right now I'll pick up on the dietary factors, that how we can improve our quality of health through diet is very, very simple. We have never been taught how to eat healthy. Whatever is put on our platter, whatever is commercially available, you can buy boxed meats, boxed fruits, boxed everything, and it is put to, whether you go to McDonald's, you go here and there, wherever you go, whatever food is available in the market, we never pay any attention and think, well, that's the right thing to eat. So the first basic principle of good nutrition is that the food should be life sustaining. And what food is life sustaining? It is fresh meats, fruits, vegetables, grains, greens, beans, and whatever, and with all the herbs and spices and stuff like that. You want to put it in there to make it delicious. That's all you have to do. Fresh meats, fruits, vegetables, green beans. Right now, what our healthcare crisis is that everywhere you go, you see prevalence of SAD diet. Most people never heard of the term SAD diet. They try to think what it is, but it's really very simple. Standard American diet, full of added preservative, coloring dyes, canned meats, canned foods, canned vegetables. So this is not this diet is going to promote sickness. For example, just take in the diet wrong fats. We don't, when we go and buy McDonald's or buy other fast food, we never think about just one factor in there, that what kind of fat does it have. Now, wrong kind of fats are an important cause for all sorts of degenerative diseases, autoimmune diseases, hypertension, coronary artery disease, stroke, and all those things related to that. We never thought of what kind of fat we are eating. So I'm just going to focus on a minute on that. You see, the fat, you've heard, or you have probably used margarine, or sometimes you Crisco shortening, or sometimes you read on the food labels says partially hydrogenated oils. What does that mean? You see, what that means is that take an oil, raise it to 1,000 degrees, and pass a lot of hydrogen through that. If a lot of hydrogen is passed through that, it becomes solidified like Crisco shortening or margarine. If it was enough gas was not passed through, it remained in the liquid state. So a person may say, well, is it still an oil? Yes, it is still an oil, but now it is a denatured oil. It is oil transformed into a twisted molecule, which when you eat does not sit well on the cell wall. And in all of our body, all cells have cell walls, you see, and inside the cell, the organelles, they have the cell walls too. So all made up of essential part is the fat. So when it is a mangled fat, it does not sit well over there, becomes damaging. Like, for example, if I ask you, most of you guys probably sitting in a chair right now or something like that, if I say, what are you doing? So, well, I'm sitting in a chair. I turn the chair upside down and I say, sit in the chair. Oil is still an oil, so chair is still a chair. Do you see any problem by sitting in that chair for 2 or 3 decades that you could bruise your behind? Yes, you could. You see, similarly, these damaged fats cause damage to the vascular system and all the cell membranes, causing a lot of chronic disease, high blood pressure, stroke, Alzheimer's, and neurological disorders of all kinds. So first thing what you can do, now I'm talking about the diet factor, besides eating clean meats, fruits, vegetables, and all that stuff, one thing you pay attention to is what kind of fat you should be using. So I'm not here to tell you this, what you can't do, and at the same time, our job is to tell you what you can do. So what you need to do is you need to eat oils that are called cold pressed oils. Simply what that means is you take a seed, you squeeze it, and use the oil as it's coming. You do not heat it up, you do not hydrogenate it, you do nothing, and that's called the cold pressed oils. Now there are various companies who make name doesn't mean it can be sunflower oil, it can be safflower oil, it can be olive oil, it can be almond oil, it can be avocado oil, and on, grapeseed oil, and so on and so forth. So the key is what is being done to the food. So this making one little change that from this time onwards, I will never eat hydrogen oils practically all my life. It will be a positive step in that direction. And I think what we should do is now, while we are talking about in general how it should eat healthy, we should also be talking about in this program what are the health hazards of other common foods in our diet. Well, like for example, what harm sugar does to you. Okay, what harm does deficiency of some essential fatty acids does, and what are the harms of caffeine? What are the harms of white flour and things like that? And then offer solutions to what can be, how you can make healthy dietary changes. There's something very interesting that came to my mind, and we'll bring it up. You see, here is a question for you. Who do you think has the maximum impact on your health? I ask my patients that, and really say, me. The answer is no. No, it is not you. The person who has the most impact on your health is your cook. So the question is, who is your cook? If your cook is McDonald's, and if your cook is Burger King, God bless you, with all that wrong food and wrong fats they use in their cooking and preparing the foods and etc. So I just leave it at this. Next time we will talk about the hazards of the sugar and what we can do as healthy substitutes for that.
I want to add a very important article that came out from The Guardian that I read, and I want to share it with everybody. This is have to do with the illusion of choice. There's only there's a few companies that actually have full total monopoly on the American food crisis, and it is a big monopoly. We're talking about maybe between 70 to 83% of the food choices that was only owned and controlled by few handful of companies, and that would range from the meat market into the snacks industry. Will go into beverage industry, and will go into cereal industry. There's basically each one is monopolized by only 3 or 4 big conglomerate that have all this, because of even before they had a share like 30% or so in the market, but then because of recent mergers and so on, they have taken over. Although that we see a lot of choices, a lot of products, but they all are being controlled by only few handful of companies that have total monopoly on the American food industry chain. And I believe that people now, they're looking into new healthy alternatives like halal food, for instance, that's becoming taken a rise. And for the U.S. consumer this year, it's projected and had so far $1.9 trillion halal industry. Large part of it because of the growth in the nutritional industry, because of the favorable data that have to come from eating halal and eating halal products, using it all together. So it's got to be a good, healthy competition, and people are becoming more health conscious because they want to see what's the food that is free from hormones and the toxic materials and antibiotics and so on, and just want to eat wholesome, clean food and products that keep them healthy. Perfect. And keep them from disease.
Yeah, we got to mention this about the contest again, brothers and sisters. The contest is over, obviously, but the judging got delayed because one of the children was not included because they only put their first name on it and nobody saw it. So we're working on that now, and we will, inshallah, be talking about this throughout the week and showing you the different winners. We do have different winners of each group. They've decided to award prizes, special prizes, to each group, the younger ones, the middle, and then the top. And so, yeah, tune in tomorrow and stay guided with
Guidance TV.
Yeah. Yusuf Estes, and I'm looking for something. Actually, I'm looking for someone. Is that someone you? I want Dawah partners, and you can be my Dawah partner right now. It's real easy. Just go to DawaPartners.com, sign up, and join me. There are 3 things that I would like for you to be able to do. Any one of them or all of them. Beautiful. Number 1, you will make dua. So you can be our Dawa partner, even if you don't go to the website, but I hope you do. Number 2, share. Share this message and let other people know about becoming Dawa partners. And number 3, help us financially. Donate on a monthly basis, even if it's small. Allah loves the thing that you do regularly, even if it's small, more than the thing that you do that's really big, but you only do it once. Join me as a Dawa partner. Do it now. Click, 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 click.